Respiratory physiology. In this video, we are going to learn about the gas exchange and respiration. Gas exchange, it occurs between the lungs and the blood, and then it occurs between the blood and the tissues. So this is known as external respiration. In external respiration, there is gas exchange between the lungs and the blood. The gases they're coming in the lung, the oxygen is coming from the lung, and it is diffusing into the blood, and the carbon dioxide it is diffused from the blood to the lungs, and then it is expired out into the air. This process is known as external respiration. Then there is another process which is internal respiration. In internal respiration, this oxygen it is taken to the tissues, and in the tissues there is exchange of oxygen between the tissues and the blood, and then the carbon dioxide it diffuses into the blood, which is then taken to the lungs. So this process at the level of the tissues is known as internal respiration, and both of these processes they depend upon the basic properties of gases and the composition of the alveolar gases. Now let's see how these two they affect external respiration and internal respiration. First, let's talk about the basic property of gases. So we have a Dalton's law of partial pressures. It states that the partial total pressure exerted by a mixture of gases is the sum of pressures exerted by each gas in the mixture. For example, this is gas A, and this is the pressure exerted by gas A. Then this is gas B, and this is the pressure, and there is certain pressure exerted by gas B. And when we combine both of these gases in one container, the total pressure it is equal to the sum of pressure exerted by gas A and gas B. And then there is another law which is known as Henry's law. It describes how gases move into and out of the solution. So the solubility of a gas in a liquid, it is proportional to the pressure of the gas over the solution. So it means like this is how much this gas is going to be soluble in this solution. It depends upon the pressure of the gas on the top of the solution. And it states that when a mixture of gases is in contact with a liquid, each gas will dissolve in the liquid in proportion to its partial pressure. Let's see a little more about Henry's law. What it tells us that each gas it will dissolve in the liquid in proportion to its partial pressure. More the partial pressure of a gas, the more that gas will dissolve in the liquid. And also the greater the concentration of a gas, the more it will dissolve in the liquid. And this dissolving of gas in the liquid, it depends upon solubility and temperature and partial pressure. So if I say three factors they affect the solubility of gas in liquid, their partial pressure. The more the partial pressure of a gas, the more will be the solubility. Then there is solubility. Carbon dioxide is 20 times more soluble in water than oxygen. It means, how is it this relevant? Because carbon dioxide will dissolve readily in the plasma compared to the oxygen. Then temperature, as the temperature of a liquid rises, the solubility decreases. Just imagine what happens when you boil water, right? It evaporates. So when temperature is more, the solubility decreases. And then certain gases are more soluble in water compared to other. Carbon dioxide is more soluble than oxygen. And the third point we need to know that more the partial pressure of a gas, the more soluble it will be in a solution. And now what are the practical implications of Henry law? There are certain chambers which are known as hyperbaric chambers. It means that they contain gas at pressure higher than 1 atmosphere, right? So now the pressure of the gas is increased in this chamber, so it will dissolve more in the liquid. So what are these chambers used for? In case of carbon monoxide poisoning, these are used to infuse greater than normal amount of oxygen in the blood of patients. Okay, and then it also has side effects. So And then another application is scuba diving. In scuba diving, when people go deep into the water, the atmospheric pressure is different. Like we learned that when we go at a higher altitude, the atmospheric pressure decreases. When we go in the lower altitude, the atmospheric pressure it increases. So when people go deep into the ocean, they are under more atmospheric pressure, and when the scuba diver quickly it swims up to the top, the nitrogen gas in the blood it forms bubble, and that is very painful and dangerous condition. That is why there is a special protocol in which the scuba divers they do not come abruptly up to the surface. A little more on the hyperbaric chambers, that breathing oxygen gas at 2 atmospheric pressure for short periods of time it is okay, but for long terms it can be dangerous, because oxygen oxygen makes free radicals, and free radicals they are harmful. They can result in CNS disturbances, coma, and even death. We went over the basic properties of the gases, because we said that the properties of the gases they affect in external and internal respiration, and we saw that how the partial pressure of the gas it is going to affect how much that gas dissolves in a liquid. Why is it important to us? Because we are dealing with blood and the gas, right? So our blood has to come, the gas has to come in the blood, and then it has to dissolve out of the blood. So that is why those basic properties of the gases uh, they affect respiration. And now the second thing which affects respiration is the composition of atmospheric air and the alveolar air. Alveolar air, it has a different composition than atmospheric air. How does that happen? When we breathe in atmospheric air, it changes in our conducting system. How does it do that, and why it happens? Because gas exchange it is occurring in the lungs. Okay. And then there is humidification of air by the conducting passages, and then there is mixing of alveolar gas that occurs with each breath. Okay. So in our system, inside our body, the atmospheric air it is mixing with the alveolar air. Also it mixes with the air in the dead space, then it is being humidified. So the composition of the alveolar air it is different than the atmospheric air, and this table it summarizes the differences. So I will, in the atmospheric air, I will talk about only about two gases: nitrogen, because it is present in the proportion. So nitrogen gas it is 78.6% present in the atmospheric air, and oxygen it is 20.9, which in commonly we say it is 21%, almost 21%. Rest of the gases, as you can see, carbon dioxide and the water vapors, they are present in very less amount compared to the nitrogen and the oxygen. So we can say that our atmospheric air it comprises mostly of nitrogen and oxygen, and this is the percentage. So the partial pressure of nitrogen is 597 and that of oxygen is 159. So if you add these two together, they are a little less. I think they come to be 756, which is only 4 less than the 760. So now this is in the alveoli. In the alveoli, what happens to these gases? To the partial pressure of the nitrogen, it is 74.9, and the partial pressure comes to be 569, and the oxygen it is 13.7, and the partial pressure is 104. And now in alveoli, the carbon dioxide is more compared to the atmosphere. Why? Because it is coming from the tissues, right? So it is 5.2, and the partial pressure exerted is 40 millimeters. And then water vapors, because alveolar air is humidified, so the percentage is 6.2, and the partial pressure of water is 47. So this all total is equal to 760. So this is how you can calculate if you want to. So this is how the partial pressures come out to be. And so as we have seen, alveolar air is higher in carbon dioxide, and it is lower in oxygen than the atmospheric air. compared to the atmospheric air, it has more carbon dioxide, and compared to the atmospheric air, it has less oxygen. And then the alveolar partial pressures of carbon dioxide and oxygen, they are easily changed by increasing breathing depth and rate. Okay, so carbon dioxide and oxygen, they are partial pressures. They can be changed inside the body. Now let's come to the external respiration. External respiration, it is the exchange of gas between the lung between the lung and the blood across the respiratory membranes. And this exchange, it is influenced by the partial pressure gradient and gas solubilities, by the thickness and surface area of the respiratory membrane. Then there is another factor which is known as ventilation, perfusion, coupling. Ventilation means that how much air is coming in, and perfusion means how much blood is coming in. Now that ventilation and perfusion, that has to happen in the same area. For example, there is a certain alveolus in which ventilation is good air amount is coming. Now in the same alveolus, we also want the good amount of perfusion or the blood coming in, so the exchange can happen. So this ventilation and perfusion, they have to couple with each other. Let's see how the first factor, partial pressure gradient and the gas solubility, they affect the external respiration. So this is the alveolus, and this is the blood capillary. And this blood capillary, it is bringing the blood from the right side of the heart. So from the right side of the heart, the pulmonary artery, it brings the venous blood to the lung, and then it divides and redivides till it becomes very small. And now this is pulmonary artery. This pulmonary artery, it contains the venous blood, and these are the partial pressures of the oxygen and the carbon dioxide in the venous blood. In the venous blood, partial pressure of oxygen is 40 and that of carbon dioxide is 45, because this blood, it is coming from the systemic from the systemic venous system. From the tissues, it came into the right heart. From the right heart through the pulmonary artery, it has come into the lung. And these are the proportion of gas in this venous blood. Now this is our alveolar side, and where are the gases coming from in the alveolus? So we are breathing in, and then the air, it travels from the conducting system, trachea, bronchi, bronchioles, and finally it ends up in the alveolus. In the alveolus, these are the partial pressures of the oxygen and the carbon dioxide. Like we discussed before, that it changes from the atmosphere because of certain factors, that it is humidified, and then there is mixing of the gases in the alveolus and the atmosphere and the conducting channel. So these are the partial pressures which are present in the alveolus. And remember, our alveolus, it is also lined by the alveolar fluid. So this is the respiratory membrane. Respiratory membrane is a very thin side of the alveolus. The epithelial cells which are lining the alveolus, and then the endothelial cells which are lining the capillary. They are resting on a basement membrane. So this is respiratory membrane. Now let's see what is going to happen. So as this venous blood, it comes to the lungs. Let's look at the oxygen. So the oxygen, it is 40, the partial pressure is 40 in the venous blood, whereas in the alveolus it is 100. So there is a large pressure gradient, and gases, they move from higher pressure to the lower pressure. So this gas is going to move into over here, and oxygen is going to diffuse in the blood. Now let's look at the carbon dioxide. The carbon dioxide, it is 45 in the venous blood, and it is, I mean, in the venous blood, this is like pulmonary artery blood. It is 45 in this blue blood, which is present in the pulmonary capillary, and in the alveolus it is 40. And although this is not a very big pressure gradient, but because carbon dioxide, it is more soluble compared to oxygen, it is 20 times more soluble compared to the oxygen. So this pressure gradient is enough for carbon dioxide to diffuse from the blood to the alveolar fluid. And then this process from here till here, the movement of blood from here till here. This takes about 0.75 seconds. But this gas exchange, it happens in 0.25 seconds only. So this ensures that there will be adequate oxygenation, because the time it takes the blood to move from here to here is three times, it is threefold the time it is required for the gas exchange. So the same point I already said, that carbon dioxide, because it is 20 times more soluble in plasma and alveolar fluid than oxygen, that is why this small pressure gradient is enough for the movement of the carbon dioxide from this side to this side. Let's go over this figure. So this is the inspired air, and this is what are the partial pressures of oxygen and carbon dioxide in the atmosphere when they come in the alveoli of the lung. By the time they reach the alveoli of the lungs, these are the partial pressures. The oxygen is 104, carbon dioxide is 40 millimeters of mercury. Now in these alveoli, the gas exchange happens. In that gas exchange, the oxygen, it goes into the blood, and the carbon dioxide, it comes into the alveolus. And then this oxygen, this process is external respiration, and then this oxygen is taken to the tissues, and we know that this carbon dioxide, it is coming from the right side of the heart from the tissues. So over here, this is external respiration. This shows how much time it takes for the blood to be oxygenated when it is passing through the capillary, which is close to the alveoli, which is linked to the alveolus. So this is the start of the capillary, and the partial pressure of oxygen is 40. And in 0.25 seconds, it, it has almost oxygenated. So, and it takes 0.75 till the blood to reach the end of the capillary. Okay, so this is the capillary, which is around the associated with the alveolus. So the first factor which affects the external respiration, it is the partial pressure and the solubility of the gas. Now the second factor which affects the external respiration, that how much gas exchange will happen, it is the thickness and surface area of the respiratory membrane. So what is respiratory membrane? From the alveolar side, these are thin squamous epithelium sitting on a basement membrane, and on the capillary side, thin squamous cells, endothelial cells sitting on a basement membrane. So a respiratory membrane, it is very, very thin. It is 0.5 to 1 micrometer thick. This is the thickness of the respiratory membrane, which is very small. And then there is a large total surface area of the alveoli, which is 40 times the surface area of the skin. So if we spread the alveoli, the surface area of the alveoli, it is 40 times more than our skin. And so what happens, what can go wrong if this respiratory membrane, it becomes thick due to some disease? Then this gas exchange, it is going to affect it, and it is going to reduce it. So let's read this. Effective thickness of respiratory membrane increases dramatically if the lungs become waterlogged and edematous. So if there is too much water in the lungs, there are certain conditions in which there is edema. Edema means that there is water in the lung, the fluid, the plasma diffuses out of the capillaries, and then it gathers in the alveoli. So when that happens, the thickness of the wall, it increases. It is seen in pneumonia and left heart failure. The 0.75 second that red blood cells spend in transit through the pulmonary capillaries may not be enough for adequate gas exchange in this case, when the respiratory membrane, it becomes thick. And then there are certain diseases in which the surface area of the alveoli, they are reduced. It is reduced. So there is a disease known as emphysema. In the emphysema, see these alveoli, the walls, they get damaged, and then they merge and they become big. But what is the downside? The downside is that the surface area of the alveolus has decreased. So both these factors, if the surface area decreases or the thickness increases, both of these factors, they will decrease the external respiration. We are discussing the factors which affect the external respiration. We already went over partial pressure gradient and the gas solubilities, then thickness and surface area of the respiratory membrane. And now the third factor is the ventilation perfusion coupling. What is ventilation perfusion coupling? Let's see. So perfusion, the blood flow reaching the alveolus, is known as perfusion. And ventilation, it is the amount of gas reaching the alveolus. And ventilation and perfusion rates, they must be matched for optimal efficient gas exchange. And what does this mean? It means that, for example, if there is a certain alveolus and in which there is good ventilation, good amount of air is coming. Now we also need good amount of blood to be coming in that alveolus, in that particular location, so the gas exchange can happen. Both of these are controlled by local autoregulatory mechanisms. So there are certain mechanisms which can alter the ventilation and the perfusion in local areas of the lungs, and these mechanisms, they try to match the ventilation with the perfusion. So if good amount of air is coming in some alveolus, these mechanisms, they make sure that also the good amount of blood is coming in that alveolus, and vice versa. If good amount of blood is coming in some alveolus, these mechanisms would want good amount of air coming in that alveolus as well. And how do they do it? Partial pressure of oxygen, it controls perfusion by changing arteriolar diameter. We know that the amount of blood that is coming into a capillary, it is regulated by arterioles. Arterioles, they are present before the capillaries. Arterioles, they are the last, they come at the last of the division of the arteries. Remember when we went that elastic arteries, then muscular arteries, then smaller arteries, then finally there are arterioles, and then arterioles, they divide into into many capillaries, which is known as capillary bed. And these arterioles, they have uh, they can constrict or they can dilate, and when they constrict, the blood flow in the capillary bed, it decreases, and when they dilate, the blood flow in the capillary bed, it increases. So these arterioles, they are controlled by the partial pressure of the oxygen. And then partial pressure of the carbon dioxide, it controls ventilation by changing the bronchiolar diameter. So we know bronchioles, they are the subdivision of the bronchi. The bigger bronchi, they divide into bronchioles. So this carbon dioxide, partial pressure of carbon dioxide, it can control the ventilation of the bronchiole. How will it do it? When the bronchiole, it dilates, more air will come in, and when the bronchiole, it constricts, there will be less air coming in that alveolus. Now let's see how partial pressure of oxygen in the alveoli, it uh, it affects the perfusion. So this is about these up three lines. These are about the partial pressure of oxygen in the alveoli, and it is affecting the arterioles which are present near the alveoli in the lungs. So these arterioles, they are present in the lungs. So what happens when the alveolar oxygen is high, the arterioles, they dilate. When the alveolar oxygen is low, these arterioles, they constrict. And in this way, they direct the blood to go to the alveoli where oxygen is high, so blood can pick up more oxygen. And this is opposite to what happens in the systemic arterioles. What are the systemic arterioles? These are the arterioles which are present in the tissues. Over there, the opposite thing happens, because when the oxygen is low, we want more blood to go there so that the more oxygen can reach that tissue. So this is, just remember that what is happening in the lungs, it is opposite to what happens in the systemic arterioles. Carbon dioxide, it affects the diameter of the bronchioles. When the alveolar carbon dioxide is high, the bronchioles, they dilate. Now that carbon dioxide can quickly leave the lungs. It can go out. And where the alveolar carbon dioxide is low, these bronchioles, they constrict. And this is how they aid in the elimination of the carbon dioxide more rapidly. Both of these mechanisms, the effect of oxygen on the arterioles and the effect of carbon dioxide on the on the bronchioles. They are trying to balance ventilation perfusion. So they want the maximum air to be present where there is maximum blood flow, and the less blood flow to go where there is less ventilation. So changing the diameters of the local arterioles and bronchioles, it synchronizes ventilation perfusion. Ventilation perfusion is never balanced for all the alveoli in the lung, because so in the normal, this is about the normal lung. It is not that same amount of ventilation perfusion is present in all the alveoli. It is different in different alveoli, and it is being locally controlled. Regional variations may be present due to effect of gravity on the blood and airflow, and occasionally alveolar ducts, they get plugged with the mucus, and now that alveolus is unventilated. So this ventilation perfusion coupling and this regulation and balancing of the ventilation perfusion, it is happening at the level of individual alveoli. So now let's see how it is auto-regulated. So in this box there is decreased ventilation, and there is compared to the perfusion. So this is comparison. There is decreased ventilation compared to the perfusion. Because of that decreased ventilation, and increased perfusion, there is increased partial pressure of the carbon dioxide, and there is decreased oxygen. That decreased oxygen, it auto-regulates the arteriolar diameter. The arterioles, they constrict. Now the blood supply going into the capillary bed, it is decreased. Now decreased ventilation has led to decreased perfusion, and this decreased perfusion, it balances the decreased ventilation. Now let's see what happens when there is increased ventilation, how perfusion is going to increase now. So when there is increased ventilation or decreased perfusion, so this is because this is a comparison of an alveoli, it causes decreased in partial pressure of carbon dioxide and increased in partial pressure of oxygen. So this increased partial pressure of oxygen, what does it do? It dilates the arterioles. Now more blood is going to the area where there is increased ventilation, to that alveolus where there is increased ventilation. So increased perfusion, it balances the increased ventilation. This brings us to the internal respiration. We went over the external respiration. Now let's see what happens in the internal respiration. Internal respiration, it is happening at the level of the body tissues. So it is between the capillary and the body tissues. And now these capillaries, these systemic capillaries, they have arterial blood. They are bringing arterial blood, and then they are taking the venous blood back. So the partial pressures are the tissue oxygen, it is always lower than the arterial oxygen, right? So the oxygen in the tissues, it is 40, and that coming in the arterial blood is 100. Remember, our blood got oxygenated in the lungs. So this is oxygenated blood, and it is the partial pressure of oxygen in the oxygenated blood is 100 millimeter Hg, whereas in the tissue, it is same as was in the venous blood, it is 40. And then the carbon dioxide in the tissues, it is 45, whereas in the arterial blood it is 40. So now the oxygen is going to exchange from this 100 towards this 40. It is going to go into the tissue, and the carbon dioxide is going to come from this 45 in the tissue to this 40 in the blood. And now the venous blood, which is returning to the heart, it contains 40 millimeters of partial pressure of oxygen and 45 millimeter partial pressure of carbon dioxide. So this is our internal respiration, which is happening at this level. In the oxygen, the partial pressure of oxygen in the arterial blood is 100, carbon dioxide is 40. So in this side, it is 100 for oxygen, 40 for carbon dioxide. Now inside the tissue, the oxygen is 40 and carbon dioxide is 45. So when this exchange happens, the oxygen, it flows from the 100 millimeter Hg towards the 40 millimeter Hg. So oxygen, it diffuses in the tissue, and the carbon dioxide, it is 45 in the tissue and 40 in the blood. So it goes here and then this venous blood, it is taken back to the heart to be taken to the lungs for external respiration. So this venous blood, it has these are the partial pressures, 45 for the carbon dioxide and 40 for the oxygen. So this is the blood which is going to reach the alveoli for to be exchanged with these gases present in the alveoli. So this is external respiration and this is internal respiration. Maybe some things seem confusing to you, but when you slowly go over these, it is very easy and it will become very clear to you. In this table, I have just written the main points which are happening in the ventilation perfusion coupling. So if some things is confusing, it can become more clear to you.